Many of you who have gone into private practice radiology probably figured, or at least hoped, that you had given your last lecture. Now, although this does not have to change, I do believe you will find that providing some educational lectures to your hospital staff and referring physicians will ultimately be beneficial to your further efforts in establishing a flourishing breast MRI practice. Why do I think this is important? First, you need to make sure that your medical staff realizes the incredible potential of this imaging modality. Depending on the environment you're in, many of them may already be familiar with it from their own literature, and in fact, it may be those very physicians who have encouraged you to begin breast MRI imaging. There will, however, be physicians who are only marginally familiar with breast MRI. You need to show them cases where MRI makes a significant impact on improving patient care. Show them how it can find disease, undetectable by any other means. You need to convince them also that this is no longer a research tool, but rather an established and viable new weapon in our war with breast cancer. Showing them case examples from their own patient population can be extremely valuable in relaying this message. I would therefore encourage you from the very first patient you image to utilize our MRI Advanced Data Management software and designate teaching file cases ranging from good examples of normal breast MRI studies through to benign pathology and ultimately malignancy. This will then facilitate easily finding the images you need to complete a lecture. Next, it can be very beneficial to teach your referring physicians what are the appropriate indications for breast MRI. You will show them incredible cases detecting occult pathology, but be sure to teach that breast MRI is not now the answer to all breast pathology. It is not a general screening tool. Avoid the temptation to image any patient referred to you by stopping this up front. Let the referring doctors know that you will accept only appropriate studies. Next, it can be very beneficial for the referring physicians to understand the basic pathophysiology behind cancer detection. An understanding of the process of tumor angiogenesis and how it affects tumor enhancement is important to understand this exam. Having taught the basic pathophysiology behind breast MRI, then the importance of appropriate imaging techniques becomes apparent. As your referring doctors understand technique, they will understand why their patients will need contrast and hopefully inform their patients of this at the time of ordering the exam. It is also important at this point to inform your physicians of how technique can dramatically affect results of the exam. Tell them that this is not like a chest x-ray, where generally an exam at one institution is about the same as anywhere else. Any appropriate techniques will adversely affect the results. Teach how this variation in technique can have a significant impact on results reported in the literature, and hopefully educate them enough that they will know to evaluate critically literature that they may come across. Have them evaluate the dynamic acquisition as to how long each acquisition was. Was it in the 60 to 90 second time range, or did it take much longer to acquire imaging, which would in turn decrease specificity of the exam? Make sure they understand that nearly all tissue in the breast eventually enhances, and unless you evaluate or look at the tissues at the correct phase of enhancement, the specificity of the exam will suffer. Next, make sure they understand the effects of endogenous or exogenous hormones on the enhancement of normal breast tissue, and in turn in the sensitivity for detection of pathology. Ask them to inform their patients of this so that the patients will understand why they may have to wait a few weeks in order to have the breast MRI performed, or why they may be asked to go off their hormone replacement therapy. Hopefully, then the patient will understand why the imaging center on the other side of town, which will agree to do their MRI tomorrow, is not necessarily more accommodating and certainly not necessarily better at performing the exam. Lastly, be sure to explain the limitations of this exam. They should already understand limitations if hormone considerations are not followed or cannot be followed due to a given clinical scenario. Additionally, let them know that some forms of DCIS cannot be detected. Although an MRI can be of benefit in evaluating suspicious microcalcifications in a patient with dense fibroglandular tissue, as it can often delineate more extensive disease than suspected by mammography, a negative MRI in the case of calcification suspicious for cancer should not preclude proceeding with biopsy. It can be beneficial to show some examples of fibroadenomas and demonstrate how on occasion they can have malignant appearing enhancement kinetics, and particularly as your program is beginning and you are gaining experience, they will often still require biopsy. It can also be of benefit to explain that imaging of the breast is most optimally performed prior to breast intervention, as the intervention can yield some degree of post-procedural enhancement. As we have discussed already in the MRI overview section of this course, this is most prevalent with open biopsies and much less prevalent with percutaneous biopsy. In conclusion, although putting together a high-quality lecture can involve significant time investment, I do believe that you will find this ultimately very beneficial to your referring physicians and in turn to your breast MRI program.